So this all started with an idea back in 1998 when I walked into a childcare center just learning play therapy and seeing a lot of children not being cared for. And I ended up writing for a fellowship with the idea of going into childcare centers. So what happened is I didn't get the fellowship, but I did it anyway.
The center is providing a critical gap that we have right now in the mental health community. There's services all over the county for adults and for adolescents and some for children, but what the center is able to do is fill into some of that gap for the younger children and getting in there earlier, getting into the homes to where maybe the crisis hasn't quite happened yet, but we're heading towards that direction, and really just giving the kids a better chance.
There are so many kids that we are screening every day that have some type of behavioral, developmental, emotional problem, and there just really aren't enough services in the community to be able to see all of the children. The concept of trying to best educate the local therapist to be giving the best medical care to these children is part of what the center believes in, trying to not only see these children and give them therapy, but educate the community, especially the specialists in the area, so that they're giving the best care that they can.
The YWCA has had a long relationship. When we started, it was All Bout Children, and that relationship has gone on for about 14 years. And it's been a very good relationship, and it has evolved during that time into a holistic program. We started out with observations of the children. We brought in some play therapy. We also incorporated training for the teachers along the way, as well as support and assistance for the teachers in the classroom.
We'll be partnering with them in a great way. I'm really excited because we actually giving them a room. So they're going to have this room where they'll be able to provide services not only to the child, but also to the family. So we'll be able to provide these counseling services to the family and the child. We'll be able to provide play therapy right on site. Now the process used to be we have to go to another agency or referral process, and that could take 2-3 months, maybe a year. But now it's immediate.
We got connected when my son was 2.5. He was born in Russia, and we brought him home. He was very behind in his social development, in his ability to deal with people, and we heard about this thing called play therapy, and we had no idea what it was. And so he started with play therapy and really started to blossom.
I'm the parent of an adult mentally ill daughter who we recognized very early in her life that things were not quite right. But at that time, which is more than 20 years ago, the mental health profession had concluded that those matters weren't to be addressed when a child was young, but as they matured. And with Amanda, as we saw the older she got and the more that we took steps, we realized that there would have been a benefit if we had had the services of a place like this center to be able to help us as parents understand and her mature through the issues that she had. And now we're going through it again in that we have the blessing of raising a grandson that she's unable to care for. So we'll see through his evolution, knowing what we know now about Amanda, and also knowing what the center can provide, how his life can be different as he grows through his stages.
Families can come through just self-referrals. They can give us a call and we'd be happy to connect them. Right now we don't have any wait lists and we have all of our therapists ready to go. So we are able to see families in a timely manner. We also can see families who have been referred through ChildNet, which is the foster care system and dependency system, as well as their pediatrician, child care center, or school.
There's not anything else like this in our community, and parents need to know that there are resources available, that there is still hope, and that there are people who understand what they're going through and what their kids are going through.